We're now joined by State Senator Joseph Vitale, who is the chair of the Senate Health, Human Services, and Senior Citizens Committee. Senator, good to see you.
Good to see you.
Listen, I want to get this out of the way. You and I were talking right before we got on the air about kids. You have two daughters, and what are their ages?
4 and 18 months, 19 months, give or take.
So I've asked you about childcare before. You deal with it. I deal with it in a very real way. Our series, Reimagine Childcare, looks at affordability, accessible, quality childcare. More important now than ever before, Senator, particularly 2 years plus into the pandemic.
Yes, we pulled our daughter out at the time she was 2, almost in the very beginning of the pandemic. We weren't comfortable with the kids, as you know, in daycare. Whether it's ear infections or pink eye or whatever else they bring home, they share things, right? They share cups, they share the air, they share goo, right? So it's just a big mess sometimes, and you can't prevent that. But we were obviously concerned about her safety, and she has not been back since for a variety of reasons. One is that children her age are not yet eligible for, there is no vaccine that currently exists for her, or my younger daughter, who's 18 months old. So until there is that solution for us, at least from our perspective, they won't be going back to daycare. We're fortunate to be able to do something at home with the pod and some other parents. But the vast majority of New Jerseyans who are working class folks can't afford to do that. And they also need to go to work. They also need to be able to have their kids in a place that's safe. I'm concerned that, the masks are off for kids who are between the ages of 2 and 5, where a vaccine does not yet exist. But that's the way the rules are now, and that's the way it is. So it doesn't mean that I'm going to follow those rules or subject them to the possible effects of COVID. I'm bringing it home. I have a friend who works for a company. Her 3.5-year-old son brought COVID home from daycare. Now she has it. And so there's still that opportunity and that risk. And in any event, we need to be able to make sure that our daycare centers or childcare centers are safe, that we have the right staff, and it's a safe place for families to bring their children.
Senator, let's go to the other end of the spectrum. Biggest lessons singular, that you take away from the nursing home situation in our state and our nation, particularly as it relates to COVID and what the tragedy that happened in those nursing homes as it relates to people who died, 8,000 plus people, patients in nursing homes who died. Biggest lesson you take away from the nursing home situation in our state as it relates to COVID?
I think preparedness. Well, there are more than just
well, then go ahead. That's unfair to you, Joe. Any lessons?
Well, I think one is preparedness. One is trained staff. We've introduced since the very beginning of the pandemic, we right away rushed out and we produced legislation and new laws that began to have some effect on this. One has to do with infection control. The other has to do with staffing and paying staff the right amount of money so that they'll be able to attract and retain good staff who work in nursing homes. It's a tough job. But more than that, it's the congregate settings that nursing home residents live in. And when you have an outbreak, whether it's COVID or pneumonia or anything that's airborne, there's always that risk that seniors who are already immunocompromised because of their age will be impacted by whatever that happens to be. In this case, it's COVID. So it was the right kind of leadership in those facilities, the right kind of having enough nurses, not just CNA certified nurses, but nurses, people who understand infection control. These are really important elements. You don't put 300-400 senior citizens in a congregate setting and hope that nothing bad happens because you think you know what you're doing. When we lost 100 of 300 veterans at the Menlo Park nursing home, that was most of that was a result of poor leadership, poor management, and in some ways it was reckless and careless and just awful. The Department of Justice is still investigating some of these facilities, whether it's nursing homes or veterans homes, to find out exactly what went wrong. We know what went wrong, but it's always obviously important to have a DOJ in there because no one fools around with the Department of Justice. They ask questions, you have to answer those questions.
Senator, let me ask you this. It's interesting, 2 years plus into the pandemic, we're taping in the middle of March, it'll be seen a little bit later, and it repeats unless something dramatically changes. So we are where we are, or we think we know where we are with COVID. in a better place than we were, but we don't know what's going to happen. That being said, our public health infrastructure, I'll put that in quotes, where is it lacking and where does it need to get stronger? In case whatever happens in the future that people say, oh, that'll never happen.
I think
That's just not a strategy.
Right. No, exactly. Well, we never thought 9/11 would happen. Never sort of in our, you sit down in a room and imagine the worst of the worst. That would never come to our brain, right? Like the planes would fly into the Twin Towers. But there have been, plenty of smart men and women, public health experts and others who have said, we're going to get a serious pandemic. And we fooled around with bird flu, H1N1, we got lucky with SARS, we got lucky with MERS, but with COVID, we didn't. And they were saying all along, there's going to be a pandemic whenever that happens. Let's be prepared for that. So that means that going forward, we have to have a strategy. What happens when either another variant happens because of COVID, or next year, the year after, another airborne virus like this, hits our country, hits the world again. We have to have enough space to treat people. We have to have enough PPE, which we didn't have in the beginning, and it's no fault of ours because it just didn't have enough, but we produced it. You have to have the right professionals and really the right plan in place so that when it happens, you flick a switch, you shut down nursing homes, you make sure that people have the appropriate PPE, that the experts come out and they tell us exactly what we need to do to protect ourselves. We were flying blind there for the first, 6 months, a year. Of course, if we knew then what we know now, the world would be a different place. But now we know. Now we know what we should be prepared for, or how to prepare ourselves for that.
Sorry for interrupting. Let me play devil's advocate and push back a little bit. In spite of knowing what we know now, there are millions and millions of people, many people in New Jersey who, quote, don't buy it, meaning they don't buy that COVID is as serious, it was and is as serious as it is. They didn't buy the mask thing. They didn't buy the vaccine thing. It's the government. You can't trust it, blah, 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 blah. Listen, how do you counteract that?
It's a $1 million question. I think that it can't be partisan. I don't think that President Trump at the time was helpful at all. When he didn't talk about it for several months, kept it on the down low, didn't want to upset us. Well, that didn't help because the virus
in a couple of months, Senator, it'll all be gone.
Yeah, exactly.
0 cases.
Wave of the hand is not a problem. And so we didn't even let our guard down. We didn't even have a guard. We said, well, it'll be fine. But because this is such a communicable disease, so highly contagious, that it just spread like wildfire. So I think that people have to be honest with themselves. This is in public health and the resources that we put into public health, whether it's New Jersey historically or other states, public health initiatives and awareness always been sort of the redhead stepchild. I can say that because my wife has red hair, but they've always been so low on the totem pole because they weren't perceived as being an important element of our budget. Well, now we know better, and so I think educating individuals and trying to reach out and not making this political. This is shouldn't be a partisan issue. But I've heard from my Republican colleagues, unfortunately, that masking is awful. It's harmful. Social distancing is a joke. The vaccines don't work. Nothing is really.
These are elected officials. These are not just people.
Yeah, and so they're playing to some constituency that they perceive or maybe real in their district that exists. But if we're going to lead, we can't watch the parade go by. That's not leading, and feeding or their comments that feed into that narrative that the vaccines are ineffective or masking is awful. It's a violation of our rights and all that crazy talk. Well, in my view, at least, no one has the right to infect me or my children because they decided to be non-compliant.
Yeah. Well, I'm not going to open the Pandora's box, but but I'll tell you what, as we have to wrap up, Senator, but you don't have a right to walk in a restaurant and spit in someone else's food. You don't have a right to blow smoke in someone else's face. It's someone else's health, not just your decision. It's not my job to editorialize. Sorry, I did. Senator Joseph Vitale is the chair of the Senate Health, Human Services, and Senior Citizens Committee. Senator, thank you so much for joining us.
My pleasure, Steve. Good to see you again.
We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Sharing Network, The Turrell Fund, supporting Reimagine Childcare. Investors Bank. Englewood Health. The New Jersey Education Association. Horizon Blue Cross Blue Shield of New Jersey. Seton Hall University. The Healthcare Foundation of New Jersey. NJM Insurance Group. And by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. And by Employers Association of New Jersey. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network. And by Insider NJ.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. Reimagine Childcare, formed by a coalition in New Jersey, is dedicated to improving accessibility, affordability, and quality of childcare and reimagining the way we support these essential providers. Learn more by visiting reimaginechildcare.org.